Hello, can you guys hear me?
Yes.
Yeah, hear you clear.
Yeah, okay, great. Yeah, all in all, you did a great job, and I hope to
Uh,
see you in the coming weeks as well.
Okay, inshallah. Yeah. Thank you,
Okay,
Mr.
okay,
Jamil.
we have another station. Is anyone willing to be a participant for the second station? Anyone?
Hello.
Hello?
Am I audible?
Sorry?
Am I audible?
Yes, yes, we can hear you. Do you want to do the second station?
Yes. Second station is Bad Bay, right?
Yes. Okay.
Okay.
Mm, and as usual, as I said before, each station is 9 minutes. I'll give you 1 minute for preparation, 6 minutes for history taking, and 3 minutes for question answers.
Okay.
Okay. This is the second station, and your 1 minute has started. Just let me know when you're ready.
All right.
Are you ready?
Yes.
Okay.
Hello. My name is Dr. Dazims. I am one of the surgical doctors. May I know your name and age, please?
Hi, I'm Tasin. I'm 42 years old.
Okay. All right. That seems nice to meet you. So today I have been told that I need to ask you a few questions regarding your situation. During this time, I'm going to note down a bit, but I have to reassure you that it will be kept confidential. Is this all right?
Yes, bro.
All right. So can you tell me more about your conditions, Dasim?
So I'm here with back pain.
Yes.
It hurts a lot.
All right. Can you show me where exactly the pains?
Pain is in my lower back.
All right. Can you tell me when it is started?
It initially started one year ago, but it's been excruciating for the last 2 days.
Oh, I'm so sorry to hear that. Did you feel pain anywhere apart from your lower back pain?
Like I feel like the pain's going down my legs.
Oh, okay. I'm so sorry about your condition. So is there anything that making your pain better or worse? Do you notice anything?
No, no, but it does get worse when I try to move my legs.
Okay. And when you feel better, do you notice?
No, no, like for the last 2 days, nothing made it better.
Can you describe the pain? How it is like? It is a sharp pain or dull pain?
Like the back pain is like it is sharp. It is a dull pain, the back one, but the one that
Okay,
goes down, it feels a
okay,
bit sharp.
okay. All right. I'm so sorry about that. So, if you have to rate your pain like 1 to 10, how would you like your rate your pain? 10 being the worst.
I would say it's a 9.
Oh, you must be in really pain. Do you want me to offer any painkiller?
No, not at the moment.
Oh, okay,
I
okay.
tried
All
painkillers,
right.
nothing's working.
O- Okay. All right. All right. So, mm, did you feel, you said you have strange feeling in your leg, right? So it is your feet, your legs feel weaker than usual.
No, not really. No.
Okay. Is there any problems with your water works or bowel habits?
Yeah, I did have an accident in the morning today.
Okay. Okay. I'm so sorry about that. Did you have any difficulty gaining an erection?
Yes.
Okay. Do you have any unintentional weight loss
No.
recently? How was your appetite recently?
My appetite's been the same.
Okay. Do you feel like your back is like stick in the morning?
No.
All right. Do you have any fever or night sweatings?
No.
Okay. Do you have any trauma to your back recently?
No. No.
Okay. All right. So, did you take like have you ever been fractures before? Like have you found that your bone is fractured easily than before?
Sorry, can you come again?
Like you feel like if you got easy fractures or
No.
recently? Mm-hmm. Okay. So do you have any, are you taking any medication?
I used to take codeine for my back pain, but at the moment it does not seem to help.
Okay. How long did you take this drug?
I've been taking codeine for the last year.
Okay. Last year? Okay.
For the last year, yeah.
Okay. Do you know the dosage?
Around 30 milligrams every 6 hours.
Okay. So do you have any allergies
No,
to any medication? Do you have any other medical conditions?
I have diabetes.
Okay. All right. Have you ever admitted to hospital before?
No,
Any of your family member have this kind of complaint?
no.
Okay. Um, so I will ask you a personal question. Is it all right?
Yeah,
Okay. What do you do for a living?
I work in a warehouse.
Who do you live with?
I live alone.
Okay. Do you have any problems moving around your house?
At the moment, I cannot move my legs because of the pain.
Oh, I'm sorry about your situations. Okay. Do you smoke or drink?
No,
Okay. So do you have any ideas and concern about your situation?
I don't know. Like I thought this was gonna go away, but it's not.
Okay,
Like
Mr. Dessens, we will try to have you by doing our investigations and what is going on with you, and we will let you know. All
okay,
right?
6 minutes are up. Present your
Okay.
case.
So there is Mr. Tassin, who is 42 years old, but came to our department with a lower back pain. It started with last year's, and he feel like a excruciating pain, which is radiating to the lower leg, and it is a kind of like sharp pain, and he has some problems with his water walks and bowels, and he have also difficulty with erections as well. So he has been taking codeine for 1 year, but it doesn't. 1 year for 1 year, 30 milligram of every 6 hours, but it doesn't seem to work right now. And he has also have a diabetes, and he was concerned that his pain is not moving away right now. So but due to time restriction, I am not able to ask about the systemic condition. If I have time, I would like to ask that as well. So, according to the positive and according to my history taken, I think the patient is having a um, Goddard-Aquina syndrome.
What are your differentials?
So I will also think about like spinal canal stenosis and maybe in the body where this prolapse and spondylosis or ankylosing spondylitis and malignancy, but it is very rare to happen in this patient.
Uh, what is Corday-Equina syndrome?
It's It's happened into the compression to the lower end of the spinal cord, and it can causes the cellular anesthesia, bladder and bowel dysfunction, and also numbness around the genital areas, and sexual dysfunction, and also bilateral sciatica as well.
Like, what is it? You described the symptoms. What is it?
And what do you mean? It's syndrome, right?
Why is it, like, what causes caudate
Cellular
syndrome?
anesthesia is
Now,
compression to the
caudate syndrome?
compression to the spinal at the end of the spinal cord, right? Spinal nerve.
What is that called?
It's a spinal stenosis.
You mentioned end of the spinal cord. What is that called?
Quadra equina.
Okay, right. Um,
Okay.
so what investigations will you do for this patient?
So to complete the examination, I would like to do the neurological examination and full back physical examination. And I would like to exclude the other differentials by doing the full blood counts, urea electrolyte, liver function test, CRP, C-reactive protein, and erythrocyte oxidation rate. And I also would like to do the X-ray, and if we like it is in this case is the quarter equina is suspected, I would like to order an urgent MRI also, and yes. And also, if I consider above the fracture, I would like to do the DEXA scan as well.
Among all of the investigations that you mentioned, which one is the most important?
Is MRI, urgent MRI.
Cauda equina syndrome, is this a radiological diagnosis or a clinical diagnosis?
It's a clinical diagnosis. So the most important one is neurological examination.
What is the management? What will you do? This patient came in, back pain, you suspect cauda equina. What will you do now?
Mm, so I would like to do the urgent surgery if it is confirmed that it is quadra equina syndrome.
Okay. See the prompt.
Yeah.
Where are you?
It's in emergency department.
Yeah. So what will you do?
So firstly, given the physiotherapy and also analgesics, uh, according to WHO later, and also short at the master lessons.
Okay. You mentioned surgery. What surgery will you offer for this patient? Will anyone offer for this patient?
Mm, I don't know. Is this the
Okay, that's
okay?
okay.
I will skip this.
Yeah, fine. That's completely fine.
Okay.
All in
Where's the
all,
surgery name?
I'll come to that in a bit. I'll
Okay,
answer all
okay,
of the
okay,
questions.
okay.
All
Thank
in
you.
all, you did really good. You asked about all the important points. You asked about, let's go through it together. You asked about, you told your name. You confirmed the patient details. But one thing I would point out is when you're starting, you said that you've been told to ask some questions.
Yeah.
Yeah, you're a doctor. This is your job.
Okay.
So you don't have to tell a patient, oh, I've been told by someone to come and talk to you.
Okay. All right. All right. Okay.
It sounds
Understand.
like someone is forcing you to do this.
Yeah. Yes. Yes.
Like, I don't think they're gonna cut a mark for it, but it just sounds unprofessional.
Yeah. Yeah. So skip that part
Yeah,
maybe.
just skip that part. Just say, your Dr. Tazin, one of the doctors here, and move on from there.
Okay. Okay.
Visiting complaint,
Thank
yeah,
you.
back in elaboration, you did that. Close questions, you asked all of them. That's good. Yeah, severity, exacerbating, relieving, timing, everything was okay. Any other you asked about fever. You asked about weight loss. That's complete. That's perfect because we need to rule out malignancy here as well. Past medical history. You asked about that. Medication. Did you ask about medication?
Mm, and I asked about, yeah, you told me codeine, right? But I didn't
I
ask
said
about diabetes
diabetes medication.
diabetes
Yeah,
mellitus. Yes,
yeah,
yes. Yeah.
yeah. I did not ask about allergies, but yeah, that's okay. I I wouldn't hold that
Okay.
against you in this station. Family
Mm,
history. Uh, fine. Yes, about that. Travel, not that important. Occupation, that is important here. The patient works in
mm.
a
It's
warehouse. What does
a
that mean?
warehouse, yes.
He
It's
does
a
heavy
worker,
lifting.
heavy
He does
lifting,
heavy
yes.
lifting. So that is a
Yes,
risk
yes.
factor for an
Risk
intervertebral
factor.
disc prolapse or corda.
Mm.
Alcohol,
So
yeah.
should
or-
okay.
Yeah,
Yeah,
sorry, go on.
okay.
No, you
So
were
should I
asking about.
mention that he's living in a warehouse in my presentation as well? Like it's a
Yes,
Constantine
yes,
team, right?
yes.
Okay, okay,
Because that is a
okay,
risk factor.
okay, okay.
Smoking. Another thing that was important here is diet and exercise.
Uh, okay. So is it
People with
like
a higher
it is
BMI have a higher risk
okay,
of having intervertebral
okay, okay,
disc prolapses.
okay.
Okay. So in when you're presenting your case, it has to be
Mm-hmm.
the patient details,
Mm,
the answer from the close questions, the important positive findings, and
okay,
the associated negative findings to rule out the differentials. Then you go for the
okay,
past medical history and all that. So
okay.
idea, you asked about idea, you did not ask about concerns or expectations.
Mm, yeah, I don't have time for that. I guess time for WhatsApp.
Yeah, so I would suggest that you focus a bit less on the differentials and more on the concerns
Okay,
and expectation, because in real life, your management of any
okay,
patient will depend
okay,
on their expectations and their concerns.
okay, sir.
Because you already know from the history that this is most likely a cauda equina. The patient
Mm-hmm.
has problems with this sensation, patient has problems with his waterworks and bowel, right? So you're thinking cauda
Yes.
equina.
Mm,
The other questions you ask are just tick boxes, but these are very important, the expectations and the concerns.
okay, sir.
That's the patient like if the patient does not want surgery, you cannot force the patient to have surgery, even though this is an emergency condition. Do you
Yeah,
get what I'm trying to say?
yeah, yeah.
So I would recommend everyone. You might miss differential, but please do not miss the ICE questions. That is very important. That is more important than differentials,
Okay,
especially in the UK.
okay.
Because yeah, you might miss something, but if you do something against the patient's wish, you're gonna get sued. Sorry about this. Okay, differentials, quadripana, prolapse, metastasis, spondylitis. You answered all of these. That's okay. And your presentation was really good. I have no complaints about that. One thing you did not ask is about perianal numbness. And during presenting, you said the patient had problems with his waterworks and bowels. You're presenting to a doctor.
Yeah.
So use use medical terms, the more appropriate terms like incontinence.
Incontinence. Okay.
And again, you didn't ask about perineal numbness, but that's and I mentioned that I cannot move due to my pain. This is a huge red flag.
Yes.
When you try to do a neurological examination on me, it's going to be very inaccurate because I cannot move due to my pain. You cannot see what the power in my legs. because of that.
Okay.
Past medical history is diabetes. Worked in a warehouse. Again, this is very important because I do heavy lifting. I'm more prone to injuries like this. And diet includes fat, fried food. What does that mean? I might be overweight. Another risk factor. So if you notice this, you're gonna see I skipped a lot of stuff, but I kept the most important ones that shows, oh, this is all risk factors for quad iguana.
Yes.
I did not mention about ten pain. I just wrote extremely severe. I included the warehouse because it shows quad iguana or prolapse. I included the diet because it showed I might be overweight. Another risk factor.
Mm.
Okay. Let's move on to questions. What is quad iguana? I I have to prompt you to get the answer. You were saying spinal stenosis, which is correct, but spinal stenosis where?
And
Spinal
correct.
stenosis can happen anywhere in the spine.
Okay. Okay.
This is called iguana syndrome. So spinal stenosis on the chorda iguana.
Okay.
You mentioned about symptoms. That's good. Investigations. You mentioned all investigations. Perfect. The full examination of bloods, X-ray, MRI. The last one is if you're suspecting TB and if you have time, but I wouldn't focus on that. The most important investigation among this is MRI. So even if you forget the others, please don't forget the MRI.
Okay.
You mentioned that quad equina is a clinical diagnosis, correct? And the management. That's why I asked you to look at the prompt. You are in A&E. You're seeing the patient for the first time. That means you're a doctor in A&E.
Yeah. Okay. You have to refer.
So the role of an A&E doctor is to resuscitate a patient if the patient is in shock, and then send the patient off, stabilize the patient, then send the patient off to their appropriate treating team. In this case, chorda equina is dealt by neurosurgery or a local spine team in the UK. Any doctors will not operate on this patient. So the correct answer is for your management, uh, urgent referral to the neurosurgical team or the local spine team.
Okay, that's fine there.
And the last question is just a bonus. If you're doing well, they might ask you this. What surgery would they want to do? As this is a chorda equina, they're going to do a lumbar laminectomy and microdiscectomy. Again, this is just a bonus question if you're doing well on the other questions and you have time on your hands. Do you have any questions?
No, this was perfect. Your guidance is perfect. Thank you.
So I couldn't hear what you're saying, what you were saying.
I was saying your guidance is really perfect. Thank you so much for
Oh,
your
thank you. Thank you
comments.
for attending.
Yeah. Yes.
So I will share the slide with you guys in the group so you can have a look.
Yes, please.
The main thing about history taking is this format over here. If you follow this format, it's very difficult to go wrong. This format goes on all the important things you need to take in a history. So in some cases, you're not going to need Socrates. For example, if the patient comes in with melena or melena, I'll give you a format for that in the coming books as well. It's I Me personally, I use 40 para. Frequency, onset, duration, intensity, progression, aggravating factors, relieving factors, associating factors. But yeah, I'll give that format in the coming months. So these two formats, Socrates, Fortipara, you can use that in all history taking stations you have in MRCS Public. And if you ask the patient about any other symptoms, like she asked me directly about in what problems with my bowels or waterworks. If you just ask this patient, if you don't have anything in your mind about, oh, how can I exclude differentials, just ask the patient, say, do you have any other symptoms that you'd like to tell me? Then the patient itself, because the actors that you have in the exam, they're very helpful. So if you just ask them about this, they will tell you. So don't stress out if you're forgetting a question, if you're forgetting differentials. Just ask them. Just keep asking. They're very helpful. And everything else, it's the same for all stations. Past medical, medication, allergies, family, travel, occupation, social. Yeah, it does. Each question here might be important given the case, might be unimportant, but the only way to find out if it's important or not is to ask the question. Then you can include it or exclude it in your while presenting. So, and as I said before, when you see the prompt, have at least five differentials, if not five, a minimum of three. Please do not go anything less than three. Five is ideal, but if you do not have time, then three. A single question from each differential is more than enough to rule that out. Can you guys hear me?
Yes, sir.
Okay. So, does anyone have any questions before I end this session? Okay.
No.
If you guys don't have any questions, we'd really appreciate it if you can scan the QR code and leave a feedback in the form.
Okay.
And I hope to see you guys again in the coming weeks. I'll try to do this weekly, but yeah, but I'm gonna be busy next week, so I'll try to do it the week after. So probably on the 24th, I'll try to do another mock. But we will keep you updated on the group. If you have any questions, just post it on the group. We'll try our best to get back to you as soon as possible. And again, if you guys do not mind, please just leave a feedback on by scanning the QR code. Thank you so much for attending this mock today. And thank
Thank
you for the participants. You've been amazing. And hopefully you'll pass your exams as soon as this comes around.
thank you. You'll do
Thank you.
perfect.
So I'll leave this here for a couple of minutes so that you guys can scan it. And
Hmm.